Hello, my name is Lisa Wong and I'm an occupational therapist here in Tala University Hospital. This is a presentation on how to protect your hip after your surgery and manage your day-to-day activities. The purpose of this presentation is to show you what the hip joint looks like, to explain the types of hip replacement surgery, to explain the hip precautions. These are rules that need to be followed for up to 6 weeks after your surgery, to prevent dislocating your new hip. To explain how you'll manage your day-to-day activities after your hip replacement surgery. This includes demonstrating how to dress your lower body using long-handled aids. To teach you how to find your minimum recommended seat height and to make you as independent as possible in your day-to-day activities after your surgery. You'll receive all of this information as well in a leaflet or a hip pack when you come into hospital. The hip is a ball and socket joint. The ball is the head of the femur or thigh bone, and the socket is called the acetabulum. This is part of your pelvis. Ligaments and muscles hold the bones in place. It is really important for the stability of the hip joint. During surgery, these ligaments and muscles are cut or stretched, and they need time to heal. Because of this, certain movements need to be avoided after your surgery, and these are known as the hip precautions. It is important to follow the hip precautions for 6 weeks or as recommended by your doctor. The hip joint is not as stable as usual after your surgery, and there is a risk of dislocating your new hip. Typically, your doctor will be happy for you to stop following the hip precautions after 6 weeks, and you can return to doing your day-to-day activities as normal. There are 2 types of hip surgery, a total hip replacement and a hemiarthroplasty or a half hip replacement. The total hip replacement involves replacing both the ball and socket components of the hip joint. A hemiarthroplasty involves replacing the ball component of the joint only. As I said before, to reduce your risk of dislocating your new hip, there are hip precautions to follow. These are: do not bend the operated hip more than 90 degrees. Do not lift your knee of the operated leg higher than the hip. And do not reach forward down past your knees. These precautions are for 6 weeks. It is important to maintain an L-shaped position at the hip of your operated hip when sitting down. Avoid a V shape if possible. This will help you to adhere to your hip precautions. Some areas I will discuss in terms of protecting your new hip include sitting, walking, stairs, getting in and out of bed, toileting, washing or bathing, dressing, completing household tasks, driving, and getting in and out of your car. When considering seating, be careful not to bend too much. Use a firm chair with armrests as it gives you more support. Your seat height is important, as you should not sit in anything too low that causes your hip to bend more than 90 degrees, or that causes your knees to become higher than your hip. You need to remember to maintain that L shape. Avoid sitting on anything lower than your recommended seat height. Your recommended seat height should be used as a guide for what is appropriate to sit on for 6 weeks after your surgery. To measure your recommended seat height, first measure your lower leg, from the back of your knee down to your heel, in inches. This is known as your lower leg length. Add 2 inches onto your lower leg length to find your minimum recommended seat height. In this example, the leg length is 16 inches, therefore the recommended seat height would be 18 inches. If you can, try to measure your recommended seat height at home and use it to help locate a suitable chair before you come in for your surgery. If your seat is not high enough, you can add 1 cushion to increase the height of the chair. Please don't add 2, as it can cause slipping and sliding, and you may slide out of the chair. If your couch is the correct height, sit beside the armrest for support. Don't sit in the middle of the couch as it is not supportive enough. It can be helpful when you progress to crutches to have a mark on your crutch with your recommended seat height. A sticker or tape can be used to mark this. This is a handy guide if you're unsure if the chair is okay for you to sit in or not. For example, if you're out in a coffee shop, you can put the marked crutch up against a seat, and if the seat is the same height as the sticker or above, then it is okay to sit down. If the seat is lower than the sticker, it is not okay to sit on the chair. When sitting down or standing up from a chair, be careful not to bend too much. When sitting, make sure that your chair is at the appropriate height. Make sure the chair is directly behind you before you sit down. Put your operated leg forward slightly. This prevents too much bending at your hip when you're sitting. Reach back and hold on to the armrests and gently lower into the chair, keeping your back as straight as possible. When standing, move to the front of the chair. Put your operated leg forward slightly, similar to when you sit. Use the armrests and push up, remembering not to bend too much. When walking, use your walking aid at all times as recommended by your physiotherapist. We recommend non-slip, slip-on shoes and slippers with backs on them. Make sure to bring these into the hospital with you. Don't walk in your socks as you can slip in these socks as there is no grip. Be careful on wet floors or slippy surfaces, particularly in the bathroom, kitchen and outdoors. The grip on your frame or on your crutches are not very good in wet environments. You will need to take care if you're in a wet environment. Remember to go slower and to take extra care. The technique for walking up and down a stairs will be practiced with you with your physiotherapists. Make sure that it is important to take time on the stairs. Take it one step at a time. Make sure that there is good lighting so that you can clearly see the steps. When considering getting in and out of bed, make sure that your bed is not lower than your minimum seat height. Getting in and out of bed can be difficult after your surgery. All of the muscles need to work hard to manage this transfer. With time, as the muscles get stronger, you will find this easier to manage. Sit on the bed near pillows and swing your legs in together. Be mindful not to bend too much. When getting out of bed, swing your legs out together and sit on the bed before standing up. Once you manage getting in and out of bed, you should find getting in and out of a car similar, as the technique is the same. When considering toileting, some toilets can be low in height. A raised toilet seat will be provided when you come into the hospital by your occupational therapist. The occupational therapist will provide the most suitable raised toilet seat after measuring your leg. If you share your home with other people, ask them to leave the raised toilet seat in place. It can cause delays when you need to use the toilet each time the aid needs to be fitted. If you're going to stay in someone's house and their toilet is not the correct height, please bring the raised toilet seat with you. Sitting on a low toilet can increase your risk of dislocating your new hip. When out in public spaces, use the wheelchair accessible toilets. Most are higher and safer to use. If you're unsure if the toilet is okay to sit on, use your marked crutch to check. To fit your raised toilet seat, make sure to lift both the lid and the toilet seat. Make sure that this grip at the front is facing downwards. This secures the raised toilet seat to the front of the toilet bowl. Twist the sides to the right to tighten the raised toilet seat. To loosen, twist them to the left. Remember that the grips on your frame or your crutches are not great in wet environments, such as the bathroom. You need to take extra care. You can use a sink or a basin or a level access shower during the 6 weeks after your surgery. If you have a shower tray, you can use this if you feel confident and stable or if you have supervision. Don't lock the bathroom door if possible, just in case you need somebody to give you a hand. If you have a shower over a bath, then you can use this with a bath board. Bath boards can be purchased if you desire, and you'll receive an equipment suppliers list in your information pack. It is important not to climb into or sit into the bath for 6 weeks after your surgery. Even if your shower is over your bath, do not step into the bath. The movement required for this requires too much bending and is not recommended after your surgery. It is too risky. Avoid this for 6 weeks. Dressing can be done when sitting down to reduce your risk of bending. Have your clothes and shoes gathered and beside you or at the bedside table or on the bed before you start. Long-handled aids, such as a reacher stick and a long-handled shoehorn, will be provided by the occupational therapist when you come into hospital. These will reduce the need to bend when getting dressed. Pressure stockings, called TED socks, may be worn after surgery for up to 6 weeks. You will need help to change or remove these socks. Do not try them by yourselves. You will bend your hip more than 90 degrees, which we don't advise. When you are getting your TED stockings changed, the person helping you can help put on regular socks as well, if they're being worn. However, if you feel that a sock aid would be useful, ask your occupational therapist to check if they're in stock, and they can provide you with one. If they're not in stock, they can be purchased. Please see your equipment suppliers list for this as well. When getting dressed with your long-handled aids, make sure that you have everything set up beside you before you start. For putting on trousers, we recommend loose-fitted trousers as they are easier to get on and off. When putting them on, hold the waistband and lay the trousers in front of you, waistband up. Get your reacher stick and clasp the waistband with the reacher stick. Remember to dress your operated leg first. It is in the clothing the longest, so it is in first and out last. Get the trousers over your operated leg until it is at your knee, and you can grasp the trousers and get it up the rest of the leg. You can bend your other leg as normal to dress the other leg. When pulling up your trousers, use the correct technique with your leg out in front and using your arm rests, keeping your back straight to stand up. You can then pull up your trousers as normal. To take off your trousers, pull the trousers over your bottom, reach back with the correct technique, hold onto your armrests, back straight and sit down. You can push them down as far as your knees. Using your long-handled reacher stick, you can remove them, keeping the operated leg in the clothing until last to reduce any unnecessary bending. When using the long-handled shoehorn, we recommend that you use your opposite hand to the opposite leg. Put the shoehorn into the side to hold the shoe in place. Slide your foot into the shoe. Bring the shoehorn to the back of your heel and press down. Repeat the same for the opposite foot. This is a sock aid, and I will show you how to put a sock onto the sock aid. First, secure the sock aid between your knees so it doesn't slip. Get your sock and dress the sock aid with the sole of the sock going down the shiny part of the sock aid. Make sure that the tip of the sock is touching the sock aid. Bring the rest of the sock into the ridge and fold it back on itself approximately 1 inch. Stretch out the sock on the sock aid so there's space for your foot. Hold onto the ribbons and gently lower the sock aid onto the floor. Take a ribbon in each hand and slide your foot into the sock aid. Gently tug on the ribbons until the sock is on your foot. you can use the top pick of your reacher stick to help grab the sock on the part that we've turned down to pull it the rest of the way up. To remove the sock, you can also use this picker to take the sock off. Driving is not allowed for 6 weeks. However, you can be a passenger in a car. I would recommend that you sit in the front passenger seat beside the driver. A saloon-style car is easier to get in and out of rather than a Jeep or a similar height vehicle. As I mentioned, the technique for getting in and out of bed is very similar to that of getting in and out of a car. So once you're managing the bed transfer, you should be able to manage the car transfer as well. Car seats tend to be lower at the back and higher at the front. You can place one cushion on the car seat to increase the height of the seat. Again, please do not use more than one cushion as they can slip and slide. You can place a plastic bag on the seat to help swing your legs in and out of the car. For the car, make sure that the seat is pushed back and that there is much floor space as possible. Recline the seat a little as it helps to reduce the bending in your hip. When attempting to get in and out of the car, please make sure that you're getting in and out on a level surface, so not trying to get in from a path or a step. Getting in from a path or a step will encourage bending. When getting into a car, use the front passenger seat and make sure the seat is pushed back and slightly reclined. Put a cushion on the seat and a plastic bag. Wind down the window in the car door, and you can use this as support similar to an armrest. The other support you can use is the side panel of the car. Slide your operated leg out slightly in front of you, then using the supports, lower onto the car seat. When ready, lift and swing both legs into the car. When getting out of a car, you can reverse this transfer. First, wind down the window of the car door. Swing both legs out of the car together. Slide your operated leg out in front of you slightly. Using the window space of the car door and the side panel for support, stand up. It is important not to use the gripper over your head in the car to pull yourself up, as this encourages bending. For household tasks, take care not to bend your hip more than 90 degrees when doing light household tasks only. Avoid overreaching by keeping regularly used items at an accessible height. Slide items along the countertop if needed, and remember to do light household tasks only, so getting a hot drink or a light meal. Do a little at a time and gradually increase this amount over time. Sit down and take regular breaks as needed. Avoid heavy chores and get help if you need this as well. Similar with shopping, get help with shopping or you can shop online. If you have a backpack or an apron with a large pocket, you can use these to help carry large items throughout the house. This is particularly helpful when you're using a frame or crutches. It is very important after your surgery to be careful to avoid any falls. You will need to use the frame or crutches as recommended by your physiotherapist after your surgery. The physiotherapist will provide the most suitable aid for you. When trying to avoid or prevent falls, the following advice may be helpful. Remove mats and rugs from the hall and bathroom. Be careful of any loose wires or extension cables. Make sure you have enough light. Clear any clutter and furniture from the hall, landing, and doorways as you are using a walking aid. Before you come to hospital for your surgery, try to find your recommended seat height and check that you have a suitable armchair at home. Bring suitable clothing and footwear into hospital with you, as well as any long-handled aids that you might already have. If you need them, you will be provided with a long-handled reacher stick, a long-handled shoehorn, and a raised toilet seat. Please ask for a sock aid if you feel that you will need this as well. Finally, remember your hip precautions. Do not bend the operated hip more than 90 degrees. Do not lift the knee higher than the operated hip. And do not reach your hands forward down past your knees. Should you have any questions, feel free to call the Occupational Therapy Department on 01 414 2790. Thank you for listening and best of luck with your surgery.